So Leber's congenital amaurosis actually refers to a large collection of diseases where children are born with very little sight. They're often diagnosed by their parents in the first year of life because the parents notice that the baby fails to track visually.
You become progressively blind over time because your retina basically disintegrates. This bad gene, bad copy of this gene, allows the retina to basically break apart. So you become blind, usually by school age. And by the time you're an adult, you're completely blind.
There are actually many different kinds of gene therapy, but the type that we're using in the trial for Leber's congenital amaurosis type 2 that's going on here now is a type in which the gene delivery vehicle is placed directly into the retina of a child or an adult who's blind from this specific disorder. So we manufacture the vector here at Children's Hospital, and the vector is probably one of the most complex therapeutics that people have tried to develop yet. So it's the gene that's mutated in this particular disease, enclosed in a protein shell that we engineered from a virus.
So what we've been able to do is take the good copy of that gene, and in the operating room, the very talented retinal surgeons actually put a very fine needle in the back of the retina, inject the new gene, the good gene, into the back of the retina. And within weeks, the patients now are able to begin to see again, and over a certain period of months, we have one young man who actually was legally blind, had to sit in the front of the class with an assistant, couldn't ride his bike, couldn't play soccer, couldn't throw a baseball. He's completely back in school now. Normal kid.
One little boy from Europe who was enrolled had always wanted to run in the field day races at his school. And of course, he always had to run holding a teacher's hand because he otherwise would run off the track. And after he had surgery on one eye, he was able to run the course on his own, and he came in 5th in the school day race. And I love that story because the fact that he always wanted to run, he knew in his heart that he was fast. And that if he only had a chance, he would be able to show that. And he got the chance. And he was right. He was fast. So this was a type of therapy that was unproven, and the hospital felt that this is something worth investing in. Let's put the pieces together and develop treatments for diseases where we feel like there's strong scientific evidence that it could work, but people are not willing to take the risk involved in trying to develop a completely new class of therapeutics. You know, we had powerful collaborators for the clinical trial, but it was a lot of investment for the hospital, and nobody knew how it was going to turn out. And so I give the hospital leadership a lot of credit for making that decision because I think that this type of therapy holds promise for many genetic diseases, not just one form of congenital blindness.